Hello guys, good afternoon. This is Professor Henderson, and today I'm coming to you with a simple NCLEX style question video on how to answer NCLEX style questions. So if you are pursuing a degree to become an RN or a licensed practical nurse, I strongly suggest that you subscribe to my YouTube channel because I do post videos on a weekly basis for to help nursing students to deepen their understanding so they can able to answer these nursing questions critically and to think outside the box. So let's dive right into it. So the first question I have here, a nurse is teaching a community group of school-age parents about safety. Which safety item is most important for the nurse to include in the teaching session? So the correct answer is A. So the rationale for this question, proper fit of a bicycle helmet is important. Head injuries are a major cause of death, which bicycle accidents being one of the major causes of such injuries. So proper fit of a helmet helps to decrease head injuries resulting from these accidents. So A as in alpha is the correct answer for that question. Question number 2, the nurse is presenting an educational session on safety awareness for patients of adolescents. Which information will the nurse include in the teaching? So the correct answer here is A. Increased aggressiveness and blood spots on clothing may indicate substance abuse issues. So I have the rationale here, increased aggressiveness, psychosocial clue, and blood spots on clothing, environmental clue may indicate substance abuse. Question number 3 states the nurse is discussing threats to adult safety with college group. Which statement by the group member indicates understanding of the topic? Smoking, even at parties, is not good for my body. So the correct answer is A. Lifestyle choices frequently affect adult safety. Smoking conveys great risk for pulmonary and cardiovascular diseases. So A is the correct answer for that question. Question 4 states the nurse is caring for a patient who suddenly becomes confused and tries to remove the intravenous IV infusion. Which priority action will the nurse take? The correct answer here is assess the client. So when a patient becomes suddenly confused, the priority nursing intervention is to assess the patient to identify those reasons, to identify a reason why the patient becomes suddenly confused. It could be multiple factors. It could be change in the patient medication. It could be that the patient's coming down with a urinary tract infection. So it's critical that you do your nursing assessment. The nurse is monitoring for 4 categories of risks that have been identified in the healthcare environment. Which examples will alert the nurse that these safety risks are occurring? So the correct answer here is D. Wet floors, unmarked patient pinching fingers, indoor, failure to use lift for patient, and alarms not functioning properly. So wet floors contributes to falling. Pinching fingers indoor is a patient inheriting. Failure to use the lift is procedure related, and alarm not functioning properly is equipment related. So that's the correct answer, D. So this question states a nurse is providing care to a patient. Which action indicates the nurse is following the national patient safety goals? So the correct answer here is C. Uses of medication barcoding when administering medication. So one of the national patient safety goals is to use medicines safely. For example, proper preparation and administration of medication, use of patient and medication barcoding, and smart intravenous pump. can significantly reduce medication errors. Question 7 asks, a patient is admitted with pneumonia. When auscultating the patient's chest, you hear loud pitched continuous sounds over the bronchi. These findings are consistent with bronchi. That's the correct answer. B as in boy. Bronchi are loud, low-pitched, rumbling, coarse sounds heard either during inspiration or expiration. Question 8, the patient presents with pneumonia. Which priority intervention should be included in the plan of care for this client? The correct answer is A as in alpha. That's the correct answer. So guys, once again, please have a happy holidays, and please consider subscribing to my YouTube channel, and like and share and leave your comments below this video. Thank you so much.